It's time now for our weekly checkup with infectious diseases doctor, Dr. Isaac Bogoch. Dr. Bogoch, great to see you this morning. Let's get to it. We know that 6 infants in Ontario have recently been born with congenital measles. One even tragically died, with all the cases linked to unvaccinated mothers. Can you explain the health implications of in utero measles exposure, why these cases are happening now, and what this kind of outbreak signals for Canada, Ontario's vaccination strategy?
Right. So, obviously it's very unfortunate to hear this. And as many people know, we're in the midst of a large measles outbreak. We haven't seen anything of this magnitude for over 10 years in Ontario. The whole point of this is completely preventable, right? We know that this is measles, mumps, rubella, or MMR vaccine is a routine childhood immunization, and this can be completely prevented in pregnant women if people get the routine childhood immunizations. Unfortunately, these women did not receive the routine childhood immunizations. They were infected with measles, they were pregnant, and they passed this infection on to their unborn child. And there could be potential serious consequences of it. You mentioned that one child has succumbed to this illness. And of course, we know this is a well-trodden path. Sadly, measles is still a very common infection globally. It should not be a common infection in Canada or Ontario. And we know that it's still every year, roughly 100,000 people will die of this infection on the planet. The vast majority of them are kids, and the vast majority of those cases are completely preventable. And it's not just obviously death, there's morbidity associated with as well. People can get really sick. It can cause inflammation of the brain. It can depress the immune system such that you're more susceptible to other infections, such as pneumonia or infectious diarrhea, which can be devastating, especially in an infant.
And Dr. Bogoch, given that the MMR vaccine is contraindicated during pregnancy, public health authorities are recommending intravenous immunoglobulin upon exposure. So in your view, how feasible and effective is this approach for protecting expecting mothers and their babies? And what barriers do you see, either medical or philosophical, might undermine its uptake?
Yeah, great point. So obviously, the whole goal is to prevent infection with vaccination. But in the absence of that, when that breaks through, if someone has an exposure, especially a pregnant woman, they can get a product, as you point out, it's called intravenous immune globulin. And if it's given in a short enough duration after the exposure, it does a very good job in reducing the risk, not fully eliminating, but reducing the risk of a measles infection and then subsequent transmission to the fetus. So, number one, you have to know you've had an exposure, and that's not always the case. Some people might not know they've had an exposure. And then number two, if you did have an exposure, you have to go to a facility, usually an emergency department or a hospital that has this product. And again, it's a widely available product, but it's still an ordeal, right? You have to make sure there's an evaluation by a healthcare provider. You have to do it in a timely manner, and you have to get this product. It's typically given intravenously. So, there are some logistics involved. We do it. We absolutely do it. But I think the key barrier is knowledge. Many people might not even be aware that they've had a measles virus exposure because, remember, this is a virus that can linger in the air. So someone with measles could be in a room, they can leave the room, and you can enter that room even an hour later. And if you're not immunized, you're still at risk of getting this infection. And just one other point, I think it's important for people to know this. That's called post-exposure prophylaxis, and that's with one product. For people who are not immunocompromised or who are not pregnant, instead of using an intravenous product for post-exposure prophylaxis to prevent measles, we can just give the measles vaccine. And that's what happens. So if someone is non-immunized or non-immune to measles and they have a measles exposure, everyone else, who's not pregnant or not immunocompromised, they just get the measles vaccine. And again, it's just a vaccine, just a shot. Yeah. Very quick and easy and pretty effective in reducing the risk of measles infections if you get it close enough after the exposure.
Okay, those are some very good points. Dr. Isaac Bogoch, we're out of time, but always appreciate you and your thoughts, and we'll chat again next week. Take care. Have a good day.